Prenatal testing and diagnosis. Again, this is a part of the second year Bsc Nursing genetics syllabus, and will just brief over it. It's like a short summary which might help you all. So prenatal testing and diagnosis, it is used to determine the specific risk factors of pregnant population. So the new population should be healthy. So basically the goal for the prenatal testing is nothing but they want the new population, that is the new population which will be born, to be healthy in terms of physical and good mental health. So they want it to be physically and mentally healthy. Okay, so many genetic disorders are now diagnosed early in pregnancy to allow therapeutic options. So as stated, one of the therapeutic options is said to be termination of a pregnancy. Termination of the pregnancy, because if in case the couple doesn't want a child to be born with any kind of genetic abnormality or any kind of chromosomal abnormality which will interfere in his development in the growing years, they can always choose termination as an option to avoid it. Okay, now we'll go through the risk, okay, which can be identified on prenatal testing and diagnosis. Okay, one of them is risk for chromosomal disorders, neural tube disorders or defects, and you have multiple defects. Okay, so we'll go through the chromosomal disorders. Under chromosomal disorders, it can be because of maternal age, which is greater than 35 years old. So whenever it is about 35 years of women getting pregnant, they always say that there is a risk for any kind of chromosomal abnormalities. So you should try to conceive a child before you turn 35. Also, you reduce the chances of abortions and all kind of complications which arise with it. Next, you have previous childhood disorder. So if you have had a child born with some kind of a genetic disorder, example, you've given trisomy of 21st chromosome, that is nothing but Down syndrome. So if you have had a child which has already has Down syndrome, that just increases the risk of you getting another child which can be born with Down syndrome as well. So another risk factor over here is child with disorder, that is trisomy of 21st chromosome. Next, you have abnormal parent or that is a carrier. So over here, the parent can be a carrier of any chromosomal disorder. Consanguinity, it is marriage in same family, having blood relations but with a common ancestor. So that is consanguinity. Next, you have gene defect and structural disorders. The next risk factor which we cover up under the prenatal testing is neural tube defect. Okay, so neural tube defects are nothing but malformations which may result in defective closure of the developing neural tube. So there won't be a proper closure of the neural tube which is developing in a fetus. Okay, so over here it can be because the previous child has neural tube defects. Okay, NTD stands for neural tube defects over here. Okay, so the risk factors may increase because you have had a child which has already have been diagnosed with one kind of a neural tube defects. Okay, next you have family history, especially in the mother. Okay, so basically having a family history mostly in the maternal side or in the mother can increase the risk of the child having any kind of a neural tube defects. Next, you have gestational diabetes. Okay, also you do something called serologic testing, okay, to find out any neural tube defects in the fetus. Next, over here you have multiple defects. Okay, so the risk factors for multiple defects can be drug or chemical exposure. Examples, you have anticonvulsant. If you've known, okay, whenever you are prescribing any kind of a drug to a pregnant woman, you take a lot of precautions, and there are certain agents called teratogens, okay, which are not supposed to be given to them because they can cause birth defects in a child. That is nothing but the drug or the chemical exposure which we are talking about. And example, you have anticonvulsants or the drugs which can be given to the pregnant women to reduce the seizures. Next, you have maternal infections. Maternal infections can be of rubella, CMV, that is cytomegalovirus, and maternal diseases if poorly controlled. Okay, if they are like poorly controlled and not managed well, they can lead to multiple defects in a growing child. Next, you have the diagnostic tests which can be done to figure out all this genetic abnormalities or genetic abnormalities which can be found in a fetus. Okay, the first blood test. Okay, this is like a blood test. This rest all are not blood test. Okay, these are all other diagnostic methods. Under blood test, you have something called maternal serum alpha fetoprotein. Okay, that is the short form of it. So over here, the alpha fetoprotein is actually produced, by the yolk cell and later in the liver, which enters the amniotic fluid, and from there you get the sample, and test to see if the fetus is having any kind of a genetic deformity. Okay, it is more like a complicated procedure, and that is why it doesn't give. The advantage of it is disadvantage of it is that it can give a high false positive rate. Okay, so it can give you a negative result also, and it may be false, so you don't really rely on maternal serum alpha feto test. Okay, next we have gene probes. Okay, gene probes and genetic markers are linkages which are available for a variety of disorders. For example, you can have thalassemia, Fragile X syndrome, hemophilia. Okay, and this can be figured out by doing a routine screening for every abnormality, and it might not be available. Next we have genetic testing. Okay, and this is for those who have a family or previous obgyne history. Okay, there can be a history of an infant being born with trisomy of the 21st chromosome, that is Down syndrome, so it is recommended for those. Also, it may be recommended for couples, okay, who have disabled children, or are exposed to hazardous chemicals, because again, chemical exposure can cause multiple defects in a growing fetus. Next, we have something called chorionic villi sampling, which is again an important test which you all need to know. It can be also known as chorionic villi biopsy. Okay, it is a prenatal diagnostic test which is performed on a pregnant woman who are at a risk for carrying a fetus with genetic or chromosomal genetic defects. So this test is basically it detects any kind of chromosomal or genetic abnormalities in the fetus. Okay, so it detects abnormalities. Okay, basically it can be chromosomal, or you have any kind of genetic abnormalities in a fetus. Okay, so this is all about prenatal nursing and diagnosis. I hope you all understood it to some extent, and that's it for today. Thank you for watching it so patiently and making through it. You got this.